Hey, hi everyone. So Raheela ma'am is here with us, and we have 13 people joined in already. Ma'am, we can wait for like 2-3 more minutes,
Sure, we
right?
can.
So
We
that
can,
everyone
definitely.
joins in. Yeah, and then let's start. Yeah, hey everyone. I guess most of us have joined in, and few others will continue joining, but we can start now. So, thank you everyone for joining in. The workshop is on understanding speech delay, something most of the parents have been grappling with, especially after COVID. And we are literally blessed to have Rahila ma'am with us. Rahila ma'am has done her post graduation in speech language pathology from All India Institute of Speech and Hearing, Mysore in 2012. And she has a very, very deep expertise in this domain. Thank you so much, Rahila ma'am, for joining in.
Thank you. Thank you, Priya. I'm really happy to be here. And thank you, all of you, for joining in spite of this being a Sunday and a long weekend. And I think that's extremely important because today we're just going to talk about a couple of things, very basic things about what speech delay is, what it entails, what's the difference between a speech and a language delay. Most often, this is something that's very confusing, and very synonymously used. Speech and language are very different, and we're going to be diving a little about that. We'll be talking about the causes and risks that are associated with speech delay. And also, maybe I'll help you with certain skills that you can put into practice, something that's doable, as parents at home. And then when is the time that you can actually reach out for a professional or a professional guidance?
Yeah, just 1 minute, ma'am. Before we start off, we will also have a Q&A at the end of the presentation. So with respect to Q&A, we follow a text-only Q&A. So you can use the chat option on your meeting to mention your question. Please make sure you are adding all the details, right? Because we don't have an audio Q&A. So all the details, which you feel are required in your query, please make sure you're mentioning that, and Rahila ma'am and I will surely address it. Okay, awesome. Yeah, let's go, ma'am.
All right, so I'm just going to share my screen. Okay, so just a quick introduction. I'm working as a senior speech and language pathologist at Sakra Hospital in Bangalore. And if you want to reach out to me, you can reach out to me on my email address here. So first off, it's important that we understand how we communicate with one another. So there are three aspects through which we can communicate. One is the voice, speech, and then language. So when I say voice, many times children are not really able to speak anything. They are only able to communicate using their voice, meaning that they'll just babble or they're just making certain coo sounds. Differential cry, meaning that they have different types of cry when they are hungry or when they're in pain. And that is the only mode of communication. And then some children also develop speech, meaning they have certain speech sounds. Sometimes it could be meaningful, but sometimes not, right? Sometimes it could just be jargon speech, meaning that you won't really understand what they're trying to convey. It's their own form of language. And then the most complicated of all, it's the language, where there is a sender and a receiver, and a message is being encoded and decoded. And then there's a feedback loop, and there's this to and fro communication that happens. Now, most often than not, when I see patients in the hospital, they come to me and they tell me that, hey, you know what, my child is able to understand what I'm trying to tell them, but their speech is very unclear. So I need really help with that. Now, what's important for us to understand here is the pyramid. Okay. So the first thing here is the early communication skills, meaning before you start working on the speech sounds are sounds that are created through your articulators, through your teeth, your tongue, your lips. Okay. For us to be working on the speech sounds, the correction of speech sounds, first thing is children should have acquired all of these things before we go to the speech sounds, meaning they should have good sentence and grammar, they should have enough amount of vocabulary, good comprehension skills, play skills, attention skills, because they're supposed to attend to what we are trying to show them. So that is one thing that's really important. And as a matter of fact, that all speech and language therapists follow language before speech. Meaning, let's say, for example, if a child is not able to say a sound like ta, right, which requires your tongue to touch the palate, right? So if I have to show the child that you're supposed to say this particular sound, they should be able to look at me, pay close attention to what I'm saying, and then articulate that sound. And all of that is not possible without good attention and listening skills. And that's the difference between language and speech. Speech is basically sounds that are created through articulators, and language is the to and fro communication that happens because of grammar and vocabulary. Now, language falls basically into two categories. That is the receptive language, where it is all about understanding what is said, comprehending the commands or maybe instructions that is given to the child. And then we have expressive language, which is basically speaking, talking, or showing, pointing, gestures. All of that is basically expression. Now, when you go to a speech and language pathologist, they run a couple of standardized tests that ascertains what is your child's receptive language age and expressive language age. Let's say, for example, your child is about 2 years and 5 months. That's the chronological age. But they might not be able to understand language as a 2 year old child, right? Or they might not be able to express themselves as a 2 year old child should be able to express. So the first thing that we try to see is what is the receptive language age of the child and what is the expressive language age. And once we are able to figure that out, we're able to tell that, look, this is the gap that there is between the chronological age and the language age. And these are the things that we need to do to bridge that gap. Now, before we understand what are the red flags of speech and language delay, it's really important that we understand what are the milestones, right? And I think that was one of the questions that was asked by one of the parents. So this is the checklist that we have made at Sakra Hospital. So this is divided into a hearing and comprehension development milestones and speech and language milestones. And this checklist is from 0 to 3 months to about 4 to 5 years. Okay. So I'm going to be sharing this checklist with Priya at the end of this discussion. And I'm sure Priya will be kind enough to share this all with you. So if you look at it, 0 to 3 months, your child should be able to understand, and pay attention to loud sounds and soft sounds, should be able to look at you when you speak to them, right? Should be able to respond to the sound of toys. And what should be they doing in terms of speech and language? They should be able to repeat certain sounds, just vowels, simple sounds, or attend to the speaker's mouth. By 3 to 7 years, children start making gurgling sounds. They start babbling sounds like pa, ba, mama, basically bilabial sounds, simple sounds that are articulated through the lips, right? The fusion of your upper and lower lip. Because these are sounds that are visible to the child. And that is the reason they are acquired very early on. Pa, ba, ma, right? These are called as bilabial sounds. And then by 7 years, your child should be able, 7 months and 1 year, your child should be able to speak one word utterances. Very simple sound words like mummy, papa, bye, hello, right? Or give, take, all of that. And then by 2 years, this is pretty important age because by 2 years, children are actually testing their boundaries. Now, oftentimes what happens is parents come to me, especially mothers, and they tell me that, my child does not really show any kind of temper tantrums with others, but when I am around, they really are unbearable. And that is the reason, because this is a testing their boundaries stage, because they feel safe with you to test their boundaries. They feel safe that they can actually be, a pain, and my mom or my dad is going to actually bear with me, and I think that's very important that we recognize that that's the reason that they're actually being intolerable with me, but with others, they're actually being okay. And this is an age where children start developing phrase sentences, 1 to 2 word utterances. They start saying things like, come here, say bye, give me. At the same time, they're also able to work on their comprehension skills. They're able to understand simple stories, understand body parts when you name them, right? They are more interested in rhymes. They're able to try and imitate rhymes by 1 to 2 years of age. By 2 to 3 years of age, they're able to attend to stories, long stories, and they're able to look at picture books and attend to picture books, maybe even start asking questions, right? And start making judgments about what is being told to them. In terms of being able to speak, most of the time by 2 to 3 years, their speech has to be intelligible, not just to you as a parent, but anybody else. By 2 to 3 years, their speech should be able to should be intelligible for others, for strangers as well. And this is the age when they get very inquisitive in their nature. They start asking a lot of why questions, where questions, what questions. We actually call it as WH questions. By 3 to 4 years, they start talking about, narration abilities. They come home from school and they say, look, this is what happened at school. They start narrating. And most of the speech sounds are developed during this age, 3 to 4 years. They start saying sounds, almost all sounds except for r, l, s, and th, which are acquired, let's say, maybe after 5 years. Now, just like language is acquired in a hierarchy, speech sounds are also acquired in a hierarchy. And that's something that as parents you're supposed to know, right? By 1 year, children start saying sounds like b, p, m. By 2 years, let's say t, d. And by 3 years, almost all speech sounds except for r. Now, most often parents come to me and say, you know what, my child is not able to say the r sound, and the child's about 3 years of age. So I say, do stimulate them to speak the r sound, but you don't really need to be worked up about it, because it might take even about 5 years or 6 years for your child to develop that sound. And all children are developing at a really different pace. These are milestones. This should be more like a blueprint for us to remember that, okay, my child is doing this and my child is not doing that. And if you feel like the answer to most of these questions is a no, then I think it's a good idea to meet a speech and language pathologist and get your child assessed. Now, having talked about the milestones, like I said, it's very important that we remember that each and every child is developing at a different rate, right? And although we have a blueprint of the milestones, it's important that we remember that we need not be worked up, okay, if the child is not really able to get to that milestone at that particular age. But if you feel significantly there is a difference, then like I said, it's a good idea to get back to a speech and language pathologist. Now, what are the causes and risk factors of a speech and language delay? Most often than not, it is these causes. It could be intellectual disabilities, learning disabilities. It could be attention deficit hyperactivity disorder, something called as central auditory processing disorder, meaning that your child is able to basically listen, hear to whatever is being said, but they do have difficulty in processing what is being said, right? There's a difference between listening and processing, and that is what is CAPD. Autism spectrum disorder is another reason why children have speech and language delay. Hearing loss. Now, again, hearing loss is pretty tricky because you won't really know that the child is having a hearing loss until and unless you're paying close attention to their speech sounds, right? Because each and every speech sound is at a different frequency. So you will see that your child is able to articulate sounds while they are looking at you and reading your lips. Okay, but if you are covering your lips, now this is another thing that we noticed at the hospital after COVID. A lot of us wear masks, and hearing loss was something that came out very visibly because children were not really able to read the lips and understand the facial expressions of the person, of the parents. And then that's the reason that why it was actually easier. It was a blessing in disguise for us to understand that the child does have some kind of a hearing loss. It could be mild, it could be moderate, and that can impact the speech skills of the children. Traumatic brain injury is another one. Abuse and neglect. Now, that's something that happened after COVID-19. A lot of us were cooped up in our homes. Children didn't really have any kind of social interaction. There was no stimulation at home. Parents often had work from home and a lot of screen time that they were exposed to. And which is why we see that after COVID, there has been a lot of speech and language delay cases that have been surfacing up. And that could definitely be because of neglect, unfortunately. And it's really important that, as parents, we have to remind ourselves that not to go into that loop of guilt and shame that, you know what, I wasn't really able to be there, right? And that's something that we have to constantly remind ourselves, because if we go into that rut of shame and guilt, there's no coming out. Okay, so now when to be concerned, what's the referral criteria? Now, if you realize you've had a look at the milestones, and if you realize that my child is not really in the position where they are able to tick a yes on all of the milestones, and I think that's a good idea when you can actually go to a professional, your pediatrician or your speech and language pathologist. If you feel that the development slows or plateaus, meaning that your child was able to say a couple of words by a certain age and you suddenly see a dip in their performance, they just go mute. They're not, talking as much as they did before. If there is no consistent words by 18 months, they're not saying enough words, by 18 months, no word combinations by 24 months, because by 2 years, children are supposed to be using 1 to 2 word utterances. They're supposed to join two words, simple words, no grammar, just simple content words. Papa come, mummy give, right? So those two-word combinations by 24 months. Difficulty following instructions if they're not able to understand your instructions. And this is again tricky, because oftentimes what happens is when you are giving instructions to your children, you often use gestures and you often use pointing. You say, you know what, go get the ball from the, under the table. And the child's actually looking at the gestures and the pointing and maybe not actually following your speech or your language, right? So I think it's a good idea for you parents to step back and recognize that, is my child really following the sentence? Are they understanding what I'm trying to say, or are they really just following the gestures and the pointings? Now, in terms of speech, like I said, it's really important that you seek professional help if you feel that as parents you are, having difficulty to understand your own child's speech when they're of 2 years of age, or by 3 years, if people around are not really able to comprehend and understand what your child is trying to say. It's also a good idea to get your child evaluated if there are a lot of behavioral issues, if there are temper tantrums, if they're frustrated, if they're avoiding speaking situations, right? They don't want to talk, they don't want to make friends, they're not seeking friendships. Or even when you feel like they actually go to the playground, they look at all the kids around, but they still don't really make an attempt to talk to kids or imitate kids. That is another reason where you can actually be concerned and then look forward to a referral. Now, what could be the requirements for a typical development in children? I'd like to hear it from the parents. What do you think? What are the things that are needed for children to develop speech and language skills? You can write your answers down in the chat box. Conversations, yes. Attention, yes. Yes. Attention, parental attention definitely is really important. Conversations are important. Being able to talk to them consistently, listening to the sounds. Okay. Okay. Listening is a good point. Reading them books at a very young age. Yes. Yes. So here I've divided it into two basic parts. The requirements for a typical development in children. The first off is intact mechanisms. We have to make sure that our child is able to hear well. Now, again, like I said, there's difference between hearing and listening. So a good idea and a good practice is to get a hearing test done. When you feel like my child's not really able to pick up speech, pick up language. And also in most of the hospitals these days, it's a very compulsory thing to get a newborn hearing screening done, right? But if you feel like a newborn hearing screening wasn't done for your child when they were born, it's a good idea to get a hearing test done and be sure that your child is able to hear all sounds across all frequencies. The second is structural integrity, meaning that you have a look at their articulators. The structure. Is my child able to actually lift their tongue? Are they able? Do they have enough amount of strength in their articulators? Is there any kind of weakness that you really observe? Most often than not, very common speech problem, speech structural difficulty is the tongue tie, where the tongue is actually pressed against your the frenulum, and the children are really not able to lift their tongue. So if they're not able to lift their tongue, they cannot really say sounds like the, l, r, right? All of these sounds are all substituted by easier sounds that they can actually produce. And that is because their structure is compromised. And then obviously emotional stability, if they're really irritated, if they're dysregulated, a household where there's a lot of chaos, they can't really pay attention to what's being said to them. And then cognitive ability, being able to understand, listen, attend, right? All of that would be your cognition. And then obviously, like a couple of parents mentioned, reading them stories or having a favorable language rich environment stimulating your children right from an early age is extremely important, and it cannot be stressed enough, because we'll be talking about the critical age hypothesis shortly, but stimulation in the first 3 years of life is extremely important and is basically like a building block for your child to perform well in the later years of their life. Reinforcement also plays a huge role. And I think it's really important that as parents, you realize what kind of reinforcement, works with my child. Is it tangible reinforcement, something that I give them, or just social praise or clapping or, saying, wow, you did a good job? What kind of reinforcement is a kicker for my child? And that's something that as parents, we have to recognize and work around with. And having, of course, realistic expectations. Like I said, if you know what are the milestones, if you understand that my child is supposed to be saying these many words or these many sounds by this age, having that checklist, having that milestone list, and being aware, then I think that automatically reduces a lot of stress around speech and language delay, the conversation around speech and language delay. Now, what is the role in language, your role in language learning? Now, needless to say that the role of parents is utmost important. It's not the therapist, because the therapist actually spends about a part of their life, if you're talking about in terms of months and years, we are spending very little time with your children, with your little ones. We're spending about, let's say, 3 hours in a week, but it's mostly you that you're spending a lot of time. So it's really important that if you enroll your child in therapy, you are around to learn from the therapist, to see what are the things that they are doing, what works with my child, what kind of learner is my child. Is my child is an auditory learner? Are they able to listen sounds and listen to the instructions and then perform better? Or are they visual learners? Do they like looking at pictures? Right? So I think your role is very paramount in understanding the language learning trajectory of your child. And this is a quote that I really liked. This was shared by my sister a couple of days back. I love this quote because it says that it's not only children who grow, parents do too. And as much as we watch to see what our children do with their lives, we are anticipating, right? They're also watching us to see what we do with ours. So it's extremely important that we are a good model of what we want our children to be, right? We should always model what we want our children to do. And the way we engage with them in the preliminary years of their lives is what decides what their life is going to be throughout. And not just speech and language wise, through every means. I think that's extremely important. Now, what is the importance of early intervention? Now, again, I'd like to hear it from the parents. Why do you think early intervention is important? Because there's a lot of talk around wait and watch. A lot of parents are advised by professionals, unfortunately, to wait and watch. They say, you know what, my child's not speaking by 2 years. What do I do? Unfortunately, most of the times the answer is just wait for a couple of months, just talk to them and see how it goes. I'm very curious to know really what happens, what has been your experience as parents when you go to a pediatrician or a specialist, and have you been asked to wait? Okay. All right. Okay. So basically, yes, a lot many times parents are asked to wait and watch. And that is something that I say is not something that I would recommend, because by just waiting and watching, we are not getting anywhere. So it's really important that you take the first step and get your child evaluated or assessed, at least. Maybe not start on therapy, but just get an evaluation, an assessment done to see what's the lag that you're noticing. And if you feel that the lag is quite wide, and then I think you'll have an answer yourself. So I am not a big believer of wait and watch approach. I think it's extremely important that as soon as you realize that the milestones are delayed, we start actively working on their speech and language skills. Now, there's something very interesting called parent child interaction therapy. It's a kind of therapy that is basically given in two phases. The first is CDI. CDI basically stands for child directed interaction. Now, in child directed interaction, we have something called as PRIDE skills. This is an acronym. PRIDE skills, basically, P stands for praise. Now, it really is important that you praise your children when you talk to them. And I'm also a big believer of praising children for their effort and not for their achievement, right? And the reason that I say this is because when we praise children for our achievement, they are always trying to seek our approval, right? They always want to do better. And that can really cause a lot of anxiety and stress, not just in our children, but also in ourselves. So I think it's really important that when we praise them, we are praising them for their efforts. For example, let's say your child is doing something and, building blocks or doing something really well. And you say, wow, I see that you're putting in a lot of effort into doing this. And I really, encourage that, or good job on you for trying that so well, right? So praise them for their effort. R is reflection. Reflection is extremely important because it just helps your child to understand that you understand them, that they are being understood. Reflect on whatever they are saying. I is imitation. Let's say your child is doing something, they're engrossed in an activity. They really don't want to do an activity that you picked for them, but they want to do something else. Then you imitate them. You just follow their lead. That is imitation. If they're building blocks, you join in, you build blocks with them, right? Try and work on building the connection first. I think that's extremely important. D stands for description. Now, description is something that's extremely important. One of the parents talked about reading stories early on. And I think that's extremely important because description actually helps children to get as much vocabulary as they can get, right? So describe what you're seeing. Let's say, for example, your child is looking by the window, seeing some vehicles pass by. Talk about that. Talk about what your child is seeing or watching. Describe. It's like a radio glaring in the background. That's how your description skills have to be. E is basically enjoyment. Enjoy what you're doing with your children. Remind yourself that this is a process of them developing into a whole individual. So enjoying yourself is extremely important. So those are the pride skills, and that falls under child directed interaction. And then obviously we have parent directed interaction in PCIT, which means that as parents, you are supposed to understand what are the boundaries that you want to set with your children. It's not the job of our children to abide by the boundaries. It's the job of the parents to make them understand what boundaries really entail. And PDI also helps parents with children who have behavioral issues. So how do you work around with tantrums? What kind of techniques and strategies that come into play is something that you'll be learning in PDI. PCIT as a therapy lasts for about 12 to 20 sessions, and it also depends on the severity of or the delay of the speech and language in your children. Now we'll talk about critical age. Now, critical age is, like I said, an age between 1 to 3 years, or 1 to 5 years, where your children have this ability to learn language at a very rapid rate, meaning that the synapses in their brain, the neurons are firing at a very rapid stage, and they're able to make better connections, right? Understand words and understand a lot of language around them, which is why we always stress that don't wait and watch, because you're losing that critical age. Your child is able to understand just so much in that short span of time, 1 to 5 years. And that's the time that you should not actually be waiting and then watching your child and hoping. That's exactly what we do. When you wait and watch, you're actually hoping that your child will start picking up speech and language. But your child's not going to just start picking up speech and language without we doing anything actively about it, right? So that is what critical age is. And it's important that we remind ourselves that this is the important age and I should be really doing something about it. And then why intervene early? Why is it that early intervention is important? We are talking about critical age, fair and square. But what if we don't intervene early, right? it can lead to a lot of anxiety and stress in children. It might not, we as adults feel like it's just us who have anxiety and stress, but our children also do experience anxiety and stress, and they have very many ways of expressing that anxiety and stress. It's just that unfortunately, we are not aware of recognizing that anxiety and stress in them. And that can actually show up as avoidance behaviors. They just avoid speaking situations. They're not comfortable around strangers. They just hide behind your backs when somebody tries to approach them and talk to them. That's just anxiety. That's just stress. And that's something that we need to deal with. A lot many times, children who are not able to speak also have behavioral difficulties. They have a lot of temper tantrums. They probably, can engage in behaviors like rolling on the floor or hitting their head on the walls or pinching their caregivers or, hitting them. So those are all behavioral difficulties. And that again, indicates that your child definitely needs some amount of help. They want to speak something, but they really can't. They really can't express themselves. So how are they going to vent it out through these behavioral manifestations? Now, again, because of speech and language delay, there's inability to form friendships, and they can't really, develop social skills. There is no peer interaction. Even if you put them in a school, a lot many times parents ask me, what if I just make my child go to a play school? Will my child get better? Now, it's actually a two-way sword, because there can be good things that can happen because of play school, because your child might start imitating other kids, or your child can also develop a lot of anxiety and stress because, again, they can't really express themselves. So they feel completely out of space. They don't feel safe. So they might probably increase their behavioral difficulties even more. And it's extremely important to intervene early, because children with good language nutrition, we're going to talk about this, in their formative years are most likely to succeed at school. Now, needless to say, our spoken language reflects in our written and reading language, right? So if you have good spoken language, then obviously you're going to have good academic skills. So that is the reason that it is extremely important that we intervene early. Now, what
Hello,
do
ma'am.
we understand by
Uh,
language nutrition? Just like how
uh,
we give you know kids a good nutrition in terms of their diet, language nutrition is being able to give them an environment that is rich in quality, quantity, and context, right? And that nourishes them neurologically, socially, and linguistically. Being able to give them good amount of quality words, working on their quantity of words, vocabulary, and contextual learning. And all of this is something that a speech and language therapist will be able to help you with to understand at depth. Now, serve and return is extremely important, especially in case of infants and toddlers. Serve and return is basically when a toddler who is having a speech and language delay, they can't really express through speech, right? So it's important that as parents, we recognize what is the mode through which my child is communicating with me. Is crying a way of communication? Shouting a way of communication, right? So it's basically like playing a game of tennis. They serve you with their mode of communication, and then you return back that serve by responding them, with appropriate language. You're just trying to tell them that you understand. There's just this to and fro communication, back and forth communication that you are trying to establish, that makes your toddler feel safe. That, look, you know what, here's my mom, here's my dad, and they're able to understand me. They're able to recognize that I'm trying to communicate with them. They may be not communicating with you the way that we expect them to, or the way that we want them to, but they're still communicating, right? And there are a lot of things that you can do to improve their language nutrition. You can read them a variety of books. You can do stories together at bedtime. You can talk about things that are same and different. This is extremely important. And a very simple play activity that you can do at home. What are the things that are same? What are the things that are different? Categorize, sort, right? In case of older children, you can start working on rhyming games. You can also start on that descriptive activities, like asking your children 1 to 2 things that happen each day. And this is basically something that works on a repetition. If you're not repeating this over and over and over, we are not going to get anywhere with it. That's extremely important. Repetition is powerful. Parentees is another thing that I wanted to talk about. Any idea what parentees is? Can I hear it from you? Well, initially it was called as motheries, but thankfully it's a very gender neutral term these days, because fathers are also involved in their children's learning abilities. Any idea what parentees is? Okay. So parentees is basically child-directed speech. It is a way of speaking to children. And I'm sure that all of us do speak to children as children, right? We don't talk to them as how we speak or converse with adults. We have a certain way of speaking to children. And this is highly research-based. There's a very firm evidence that when we speak to our children in parentees, and when I say parentees, it's from birth to about 3 to 5 years of age, children do have an ability to attend and to listen. Oftentimes parents come to me and say, what, no matter what I do, my child's not listening to me. Please do try and use parentees. It's a game changer, right? So parentees is a child directed speech. Let's say, for example, you want to say something like, wow, you like that cookie, do you want it? Right? That's a simple sentence that you want to tell your child. So make sure that you're using a high pitch, you're elongating the vowels, you have some kind of a rhythm, a sing-songy rhythm in your speech when you talk about it, and you have an animated expression on your face. You have a lot of facial expressions, and it denotes that emotion on your face, right? So let's say, for example, the same example, wow, you like that cookie, do you want it? Right? So you would say, wow, you like that cookie, right? You want it, yum, yum, yum. That's so yummy, right? That's the way we talk to children. It might sound idiotic to most parents who are not used to using parentees or who don't know what parentees is, but it's extremely important that you develop that. Try and put that into practice. And every time you're interacting with your children, it's important that you talk to them in a high pitch. They react to you very quickly, right? Just put that into practice and see how it changes their listening ability abundantly. Okay, so that's extremely important. And like I said, it's not always what you say, it's how you say it with children. Okay, so it's not just the content of your speech, it's the way you say it. What kind of intonation there is, what kind of rhythm there is, and that's extremely important in parentees. Now, again, another important thing that as parents that we should ask ourselves is, what's my conversation style with my child? How do I talk to my child? Every time I'm interacting with my child, what is the conversational approach that I adopt, right? Here, I like to talk about language of commands. Now, often we interact with our children by giving them commands, especially children who have speech and language delay. Now, this is something that I've had a lot of parents tell me that, oh, yeah, you know what? I do speak to my child in the form of commands. I keep telling them, give me this, give me that, sit down, wash your face, or bring this to daddy, or bring this to mommy, things like that, right? So it's extremely important that you avoid language of commands. Recognize that, yes, you're using a lot of commands with your child, and instead use descriptive and informational language with your children. Describe what you want them to do, or tell them what you want them to do instead of just giving them commands. Language of transaction. This is pretty interesting because this is not just going to help your children in terms of their speech and language, but it's also going to affect their psyche. Language of transaction is basically when, as parents and therapists, we say, do that and then you'll get this. Oh, you want the cookie? I want you to say cookie. It's only when you say cookie, I'm going to give you the cookie. Holding back that thing and basically forcing the child to say that word and then giving that particular thing to them, that is something that I highly disapprove of. There shouldn't really be a language of transaction. Instead, a very good idea is to just tell them that, oh, you want the cookie? I hear you, right? I know that you want the cookie. Let's do this, and then let's get back to the cookie. Come on, let me help you with doing this thing, right? or doing a particular task, and then we'll get back to cookie. Or if you feel like your child's just doing this as a gesture, give the cookie to them and then just say, cookie, that's a cookie, look, that's round in shape, that's very yummy, that's very sweet, right? Reinforce the idea that you're a team and welcome collaboration with your child. Do not use this emotional blackmail, this language of transaction with your children, because sooner or later that's going to backfire. Mindlessly letting your toddler engage in screen time, that's another big no-no. Especially after COVID, we have seen a surge in paying attention to a lot of screen time. Instead of that, we can engage in interactive screen time, wherein you sit down with your toddler or with your child, and then you keep telling what's happening in the screen. There is this, you're watching the screen together, you're looking at something together, and then you're interacting about it, you're talking about it, you're making it more meaningful instead of just mindlessly looking at the screen. Do not be fixated on rigid plans. Do not think that, oh, you know what, I wanted to teach my toddler opposites today, so I'm going to do opposites. Oh, and he's not listening, right? He's not paying attention. What do I do about it? So instead of that, have flexibility. No problem. Your child doesn't want to learn opposites with you today. That's fine, right? Do what your child wants to do. Follow their lead, and you'll see that there'll be a lot of cooperation from your child. Always ask, do not tell, right? Don't give commands, ask, and give them a lot of binary choices. Whatever that they want to do, give them choices. Don't make choices for them. Ask them, what do you want to eat with the dosa? Do you want chutney or do you want jam? Right? Show them the visual stimuli. Show it. Do you want chutney or do you want jam? What is it that you want to pick? Just helps your child to be, more confident with their communication with you, even if it is non-verbal. Active listening is also important. Like, you're just actively listening to your child. You're just being completely present. You're going to look at things that, they're not necessarily saying, just reading their facial expressions. Mums and dads, you're all very good at it. You know what active listening is, right? Your spidey sensors start tingling when you know what your child wants. Now, dysregulation in parents is something that I want to talk about. It's not easy to be a parent of a child who has a speech and language delay. Oftentimes, we feel very dysregulated. There are lots of moodiness, there's a lot of stress and anxiety, and it's really impossible to be in a constant state of calm always, right? You can't be calm all the time, especially when there's so much of chaos that's going on. So it's really important that you remind yourself that there will be moments of dysregulation. I am going to be feeling stressed. I am going to be anxious, but what am I going to do about it? What's the plan? Having the plan is what is very important, because until and unless you are regulated, you have your emotions in check, you won't really be able to work on your speech and language skills with your toddlers, right? So that's very important. So I'm going to finish off this talk by the simple quote that says, not being able to speak is not the same as having nothing to say, right? So your children may not be able to speak verbally just yet, but they are still communicating with you. They are communicating with you in ways that probably we are not even recognizing. And that's extremely important for us to recognize. That's my email ID. That's my Instagram handle. You can just get in touch with me if you need any help and support. I'm open for questions now.
Awesome. Thank you so much, ma'am. This was truly super insightful, and there were so many learnings over here. Uh, and I'm lucky that we are recording this, so that everyone else can also access. Ma'am, we
Yeah,
have
we have
around,
a lot of questions here.
yeah, we have around 6 questions. So maybe you can just go through the chat and start answering them. Maybe we can start with the first question by Swati Venka. Yeah.
My daughter, age 6, is autistic with speech disorders. Don't mind, I'm reading it out loud. She's under therapy since 1.6 years and now able to form sentences, but her lines are not clear and she elongates them a lot. Will speech therapy improve, or will she be like this all life? It really depends on a lot of factors, Swati. So if she's 6 years, she should be able to say most of the speech sounds by now, if not all. But if her speech is unclear, it just means that she is probably putting in a lot of effort, but she's not really getting there as much. But as long as you think that her speech is intelligible and she's able to convey what she's feeling and what she's telling, and there's no breakdown in communication, I think it's a good idea to continue your speech and language therapy. Now, that this is another thing, a lot many times parents ask me, how many sessions would it take for my child to improve, right? And this is a very, very frequent question. The answer really is not one fold. There's just so many factors that come into play. It's just the prognostic indicators that we get from children, how their listening attention is, you know um, and each and every child is improving at a different stage, so it's very difficult to say if she's going to improve, or is her speech skills going to be that limited. But irrespective of that, I would really recommend that you encourage her to communicate as much as she can in every way that she can. In fact, I'm a huge supporter of multimodal communication, meaning that you should be able to communicate using any approach that you want. Now, unfortunately, we all are so hell-bent upon verbal language that we forget that a child is trying to communicate with us in means that we probably don't recognize or approve of. So I feel like as long as she's intelligible in her speech, you're able to understand what she's saying, I would like you to continue your speech language sessions. Um, yeah, so if nobody is able to understand, only few members are able to understand what she's able to speak, make sure that there are other ways through which she can express herself to people outside of the family, right? She should not feel limited in her way to express herself. So please use a multimodal approach here in this case, because communication is extremely important irrespective of the modality. Sayada says that she's concerned about her 6.6-year-old girl. She's still unable to pronounce the R sounds. Okay, this could be a cause of concern, because children start developing the R sounds. It's a retroflex sound, which requires your tongue to touch the palate and produce the sound by about 6 years. You can start stimulating them. 6, 7 years is the sound that we can wait till children start to learn the R sound. And if your child is not really able to say that, then I would recommend a speech language intervention. Okay, and Medha Sharma says that her daughter is 1.5 years. She only babbles all day and says, Papa, please suggest what should I do? No other word she says, however, she points out at everything if asked, and even without asking sometimes, and nods if asked about something. Yes and no, she nods and tells, but not all the time. Okay, so if she's about 1.5 years of age, then and if she's using words, and then you see that there is an intent to communicate, right? Because if she's nodding and if she's using yes and no questions, she's nodding for yes and no questions, right? Then there is an intent to communicate. She might be able to talk about her needs, maybe not verbally. Then I think it's a good idea to work on her speech and language skills, work on, like I said, the language nutrition. Make sure that you're modeling appropriate words that you want her to use. Use parentees. Like I said, it's a game changer. 1.5 years, she's going to absolutely love it. Your son is 16 months old, Surabhi, and does not say mama or papa yet. Just makes different sounds. He understands the instructions without gestures as well, but will not speak. He points and coos and babbles. There's no tongue tie, and hearing test is already cleared. So if your son is 16 months old and he's not saying any word at all, then again, I think it's a good idea to get him evaluated by a speech and language therapist. Again, it does not mean that you have to start on therapy. Please understand that when you get an evaluation done, you're just putting things on paper, right? You know what your child's language age is. What's the chronological age? 16 months. What's the language age? Maybe about 8 months, right? So what's the difference? And what do I do to bridge that gap? So a speech and language therapist will be able to help you with certain exercises, certain techniques, certain strategies that you can put into place while while you're at home, just by interacting with your children. So it does not really warrant a a speech and language therapy or sessions, but it's a good idea to get your son evaluated. Hearing loss between 2 or 3. Any suggested tests? So, hearing loss can happen because of many reasons. It could be something that is congenital by birth, or it could also be because of otitis media, which is very common in children, in toddlers especially, which is an ear infection. It is treatable again, but because of the otitis media, because of the infection, the children are not really able to listen to all speech sounds. They have some amount of hearing loss. So, it's a good idea to get yourself evaluated by an audiologist who is going to do a couple of tests. So, if your child is about 2 to 3 years old and is able to sit down in a place and respond to a subjective test, then we do something called as pure tone audiometry. Or if you feel like the audiologist will be the better person after they assess your child, if they feel like 2 and 3 years but they're not really able to sit on a chair and respond to that test, then they would suggest an automatic test called as a BERA or an OAE. It is called auto acoustic emissions. So that's another test. It's a screening test basically that gives us an idea if your child is able to hear well. Basically, there in this case, 2 to 3 years. There's also a good chance of, like I said, otitis media. So it's a good idea to get something called as impedance audiometry, which is a middle ear testing. Divya Nagarajan asks, my daughter is 2 years old and she says 80 plus words. Is it normal or speech delay? So by 2 years, your child should be able to say about at least 200 words. Okay, so if your child is unable to say those many words, again, I wouldn't really, like I said, milestones and checklists are basically, it is not warrant that your child has a speech delay, but if she's saying about 80 plus words, it just means that your child does have the ability to speak and understand words and to get most vocabulary as much as possible. It just means that we should be able to deliver it to them in ways that they can reach, right? So if she's saying about 80 plus words, I think it just means that she's able to work on her speech and language skills. It's just our work going on further. It does not really mean that she has a speech delay. But again, it's a good idea to just have a word with a speech and language pathologist to see what could be the probable reasons she's not able to pick up speech.
Hello, ma'am. This is Nazia Sheikh, and I'm calling from Vijayawada. Actually, my
Hi, sorry Nazia ma'am, we only take questions via chat, so please mention your question in the chat. We don't take audio
okay,
questions. Really sorry.
okay, okay.
Yeah.
Sorry. Okay, thank you.
Uh, Sadia Anjum says that it's frustrating to know we just need to wait, and these therapies are generally not available in every district in India. Unfortunately, yes, it's not available. In most parts of India, it's also something that a lot of us don't really talk about. There's not a lot of sensitization about speech and language therapy. Most often parents are unaware that speech and language therapy exists, that there is help available. What you can do, Saida, is you can get in touch with somebody who is willing to give you some kind of online support, right? And just get your child evaluated. You can work even if you don't really have to go in person to a therapist, and that's something that I always say: equip yourself with skills, work on your skill building as parents. That's extremely important. You don't need to always be dependent on the therapist, and the therapist is going to be there just for a part of your child's life. You are going to be there always, right? So you should know what are the things